Hi everyone, I hope all of you are doing well. So, as promised, I'm again back with another video where we're going to talk about the branch which we are supposed to choose post NEET PG. Now, definitely the exam is over, the results have been released, and we know what our ranks are, we know what are the probabilities at a particular rank, but definitely the main question now is. Choosing the branch, because at the end of the day, once you are sure about choosing the branch, then definitely you can take a call on choosing the college as well. But taking a call and choosing the right branch is a very difficult decision, and I would share some points or would share some strategies which I definitely followed while I took that decision. Right, it's based on my personal experience, and definitely it can vary from individual to individual. So those who can relate to me, definitely you guys should take down those points and should definitely focus on them while you were taking a call of taking the right branch. Now, for all year rank less than 1000, I am definitely assuring you that you guys must be very confused about the branch you have to take, because you have everything in your hand, right? You're getting all of them, and probably in the good colleges also, right? But then again, that dilemma is going to be settled or being solved by a lot of factors which you guys need to take into care before you take that branch. Now, firstly, and the foremost important thing I would like to throw some light on is that the first and most important role which is played you know in this journey is by our internship year. When we are in our internship year, we definitely are posted in different departments in rotation, so that we can have a glimpse of what every department looks like, what is the work culture there, and do I belong to that particular place or not, right? We are posted in medicine, surgery, OBGY, ortho, in casualties, in OPDs, and everywhere, so that we can understand where do we relate ourselves with. So first and the foremost thing is that you should definitely introspect that during the internship year, which was the department or which was the branch you enjoyed the most, and you felt like going there every single day, that yes, this is my cup of tea and I would definitely want to be here almost every single day, right? So that's the first and the foremost important thing. And the second most important thing which I feel is the most important thing in taking this decision will be your passion for the branch. Passion for the branch is definitely not going to develop from anywhere. That again is going to develop during your internship year only, where you'll be posted in the department, and when you work and when you realize that am I made for working for long hours of 18 to 20 hours, or maybe 15 to 16 hours in medicine casualty, or in surgical OTs, in surgery traumas, in ortho traumas. So do I belong to this particular place, and am I passionate about this thing? Will I be able to continue living this life all throughout? Will I be able to see myself down the lane over the years doing this thing and being happy about it, right? That's the most important thing. That means the passion for the branch. And the passion for the branch, what we call as dream branch, कि medicine में ये dream branch है, radiology में ये dream branch है, या derma में ये dream branch है. वो dream branch भी ऐसे ही बन के निकल के आती है जब when you decide that yes, I am so passionate about this thing, right? And thirdly, I feel that somebody from that branch who inspires you, or who you look up to, as in that, for example, in this radiology, Sumay Sethi sir or Zainab Vora ma'am, definitely they are the idols for so many students out there, and there might be so many students who would be choosing this branch just because they can relate to their idol, or they can relate to the mentors so much. Similarly, in OBGY, we have Deepthi Behel ma'am. So sometimes the taking the decision of a branch is also somewhere related to your mentor or to your idol, because you relate to them so much that yes, definitely you look up to yourself, that down the years, down the lane, over few years, I visualize myself like this, so, or maybe much better than that. So definitely that plays an important role in that as well, right? So I guess the passion for the branch, the dream branch, and somebody who inspires you, these are 3-4 things which I would really feel that they are very important when you take this particular call. Apart from that, the basic and the most important thing which I'm going to talk about right now, and which I have realized during when I was also taking the decision, or when I was also in the struggle to come to a final conclusion. Although during my internship year I was very sure that medicine would be the branch I would go ahead with, because that is what I have always visualized myself myself in. And during my internship years, I enjoyed working a lot in the medicine department, be it casualties, be it OPDs, be it wards. So I was very sure that yes, this is my branch. But now, when you get a good rank, you definitely get a little greedy and a little confused about, okay, fine, I was getting almost all the branches in good colleges out there. So why not go for radiology, or why not go for dermatology? Because definitely the work-life balance, without any doubt, is very great in those branches, right? Medicine, no doubt, is a hectic branch, but at the end of the day, if you're passionate about the branch and if you've taken that branch with your whole heart, you would definitely love and enjoy it, right? So it is definitely a fantastic branch. Like, I would never ever regret my decision of opting medicine as a branch or medicine residency, because I am in love with it and I enjoy every single day of my residency. Like, it's the first day. Definitely there are some days which are bad days, they're hectic, and I would not say that I'm enjoying those as well. But at the end of the day, you feel that satisfaction, that yes, and you feel that happiness. Not even a single day in the last 11 months I have sat down and I have regretted that I should not have opted for this branch. So my decision of taking the call between medicine and radiology was absolutely fantastic, and I'm so happy about this thing. Now, the basic confusion I have seen amongst most of the students is opting a medicinal branch or a surgical branch, and definitely, or I should leave both of them, or I should go for radiology, right? Now, I would just tell you certain points, related to these branches, which definitely are going to be the most important ones, and you can definitely take a call according to that. Now, for medicine, somebody who is interested in attending emergencies, in handling emergencies, and is not fearful of that, or is not scared of getting into that particular zone or situation where he or she has to manage emergencies. One is the emergencies. Secondly, is very importantly, somebody who is very fond of getting varieties of cases every single day. That means you do not want a monotonous thing. You want to deal with patients who are coming with varieties of diagnosis every single day. Then this branch is made for you. Thirdly, is very importantly, which I feel, that euphoria, that elation of saving a patient on table, right on, that yes, the ECG or the monitor is saying you a certain particular diagnosis, and you inject a particular drug and the patient is revived, or you definitely deliver a DC shock, and then you can just bring back the patient. So this elation, this euphoria, if this excites you, then definitely this is your call, right? So medicine is definitely made up of emergencies, is definitely made up of varieties of cases, is definitely made up of this is all about handling sometimes very difficult situations, very tricky situations, where you have to be mentally calm and peaceful, and you have to handle it all. Definitely you will have casualties, you will have OPDs, where the OPD is definitely a lighter, and they are not that hectic. But when you come to the emergency or the casualties, or the continuous emergency days, and definitely they are going to be hectic enough, right? I'll talk in detail medicine as a branch, medicine as a residency, in the next upcoming video, right, where I'll discuss everything in detail about medicine. But these are few important points that if you can relate yourself with this thing, you definitely should go for medicine. For surgery, if you are a surgery person, that means you're bold, brave, courageous enough to look at the blood in the OT all over the patient, right? You have the courage to handle the blades and the scissors. You have the courage to be in the OT all throughout the day. That means you have the dedication enough to enter into that journey of that long learning curve, because any surgical branch has a long learning curve, right? And surgical branches, I feel, are very hectic. They're more hectic than the medicinal branches, because at the end of the day, you have to invest your time in learning the skill, the art, right? In medicinal branches, you definitely have to crack the code of getting to a right diagnosis. But in the surgical branches, apart from the right diagnosis, you have to then go to the next step of operating the patient in a skillful and the right manner, right? Because definitely the post-surgical complications, some of them which are highly dreadful, will definitely make you lose your patience, right? So you have to also understand that if you are ready to be the bold person, the brave person of handling the blades and scissors, of managing the OTs, of being in the OTs for long hours. There are some OTs which run for hours and hours and hours. So definitely this branch is made for you, and without any doubt, you definitely have to go for super specialities in both the branches, medicine and surgery as well, if you want to practice in tier 1 or tier 2 cities. Because developing areas, or these particular, where you have private hospitals, where you have developing technologies, super speciality has become a little important these days. I won't say it's extremely important for your survival, but at the end of the day, if you want to flourish in the field, I would recommend you to go ahead with super speciality, if at all you are ready enough to invest another 6 years of your life for this particular thing, right? And then when I talk about radiology, I feel, this is my personal opinion again, kindly take no offense with this thing. I feel it's black and white, right? You have to be dealing with the same thing every single day. I don't see varieties in it. Why? Because you have to be with USGs, CTs and MRIs, and you have to do the reporting, right? There is very few patient to doctor interaction. So now somebody who is not fond of patient interaction and would want less of that, or maybe minimal of that, or none of that, this branch is made for you, radiology, because in this you have to just be in the console, you have to just look at the CT or MRI films, and you just have to report according to the history of the patient. And for the sonography, definitely you have to interact with the patient, you have to take a little bit history, and then you have to do the sonography, and then you have to just be away, right? So somebody who is happy with being the black and white life, or being a little monotonous thing, or living the same life almost every single day, but giving more importance to the work-life balance, the satisfaction, the money, and the mental stability, then definitely this branch is made for you, right? So these are some points which I feel are very important for you to decide between the medicine, between surgical, and between the radiological branches, right? Now, very importantly, rest of the other branches which I feel, for example, you have OBGYN, you have ortho, you have derma, anesthesia, psychiatry, or you have ENT, ophthalmology, and the non-clinical branches as well, then it is completely up to you, depending on your interest. Why I did talk about medicine, surgery and radiology in detail, because most of the students which I saw, or during my time also, when I was discussing it with my friends and with my colleagues, I could find this was a major dilemma in their decision, right? And secondly also, why rest of the other branches, they are made, or we take a call to opt for them, because we have been very clear of opting those branches from the very beginning. Internship से ही supposedly clear था कि ophthalmology लेना है या ENT लेना है, because इतना hectic lifestyle नहीं चाहिए, या फिर we want a lighter branch comparatively, right? So then वो dilemma रहता ही नहीं है, फिर आप medicine surgery की तरफ जाओगे नहीं, है ना? When you are very clear from the very beginning, या किसी को बहुत clear है शुरुआत से कि मेरे को non clinical लेना है, मेरे को PSM उठाना है एम्स दिल्ली से, and then I have to pursue it further, or I have to go and take it ahead, maybe towards higher super specialties, right? Or maybe doing fellowships or other programs as well. So there are some people who are very clear about that. So this is not for that. This is not for those group of people, that group of people, right? So jinka clear hai, they can definitely go and take a call based on that. And then the next most important question which I have got in my DMs these days is, ma'am, which is a more relaxed branch? Is it a radiology? Or it is dermatology? Okay, now let's talk about that as well. Radiology, as I told you, it's a branch where you have to just sit in your console and you have to report the films, CT scan, MRI films, and you have to do sonography of the patient. And definitely there is a very less patient interaction, right? There is no OPD, there is nothing. You have to just do a 9 to 5 job, and definitely in the first year you do have a night job as well, where you're posted in casualties, or maybe in sometimes in emergency you have to come and definitely go for the procedures as well. But I don't think there has been any emergency. There will be any emergency for you which cannot be managed by somebody else, because basic USG is being taught to other residents also. We do definitely understand what is the basic methodology of doing a sonography. So at the end of the day, we will not want a radiologist to be our side when we are handling an emergency, that one. So in radiology, definitely the work-life balance is much better as compared to dermatology. Why? I'll tell you. Because in dermatology, apart from the OPD, right, you definitely will have your wards as well. In radiology, there is no ward, there is no OPD, right? So in dermatology, you definitely will have a ward where you have a leprosy ward differently, and you have one ward where you will be managing emergencies, like you will have SJS, or you'll have pemphigus, or you might have some other drug reactions as well, right? So in dermatology, this is a myth that there is no ward and there are no emergencies. They are there, but definitely they are lesser as compared to the other branches, right? Medicine or surgical branches. But definitely there is a good patient interaction as well. There is a good OPD load as well, and definitely you have to manage your wards and emergencies as well. So the work-life balance is definitely good in dermatology also, right? But if you talk about कि मुझे तो 9 to 5 का जॉब ही चाहिए जहाँ पे I have to just sit, I do not want any patient interaction, then radiology is made for you. But if you are willing to have a good work-life balance, but definitely you want a bare minimum work, you want a good patient interaction also, then you should go ahead with dermatology. Because dermatology again, it's a myth कि patient exposure बहुत कम होता है या फिर patient load बहुत कम है, बहुत ज़्यादा है. People are taking their skin problems very very seriously these days, and cosmetically dermatology has advanced so much that there are so many interventions into it, right? And there is a good learning curve also. And definitely when you talk about the job opportunities, in both of them you have to go ahead with your private setup. Because if you are working in your in a private hospital somewhere, then definitely it is going to take you a longer time period, right, to reach to that particular stage where you definitely would want to earn as much as you want. But if you set up a private setup in radiology, initial investment definitely it is going to be a good one, but at the end of the day, these days doing sonographies, doing CT scans, and doing MRIs is quite costly, right? So it is definitely a very very good branch if you want to give importance to the money also, right, along with the skill. And similarly in dermatology, setting up a private setup, I guess it is going to bring you a lot of patients also, but at the end of the day you have to make those patients yours. So that is how I compare both the branches. Now definitely the choice and the decision is going to depend on your taste also, on your interest also, right? And then you should go and take a call ahead with that. Somewhere I feel that the non-clinical branches, ठीक है, we think कि non-clinical branches लेने से there is a effect of the reputation, or sometimes people would see the residents of non-clinical branches as कि अच्छा इन्होंने non-clinical branch लिया हुआ है तो ऐसे ही होंगे या ऐसी ही रैंक होगी करके, ऐसा कुछ people start thinking about you as them. So my advice to you will be that very importantly, your decision of choosing a non-clinical branch should not depend or should not be taken in a way कि यार लोग ख़राब सोचेंगे इसलिए मैं ब्रांच नहीं लेना चाहता. Look, if you do not see yourself fitting in medicine, surgery, radiology, dermatology, in any clinical branch, and if you feel comfortable, if you feel yourself happier by choosing a non-clinical branch, be it any, right, आप कोई भी choose करो, please take that call for yourself. Do not fall in the trap of opting for a branch just for the sake of what people or what your family or what your relatives are going to talk about. Please take this call based on your mental stability, on your mental peace, and on your happiness, right? That is going to be my most important thing. किसी को कोई फ़र्क नहीं पड़ता है आपने कौन सी ब्रांच ली है, कौन सी ब्रांच नहीं ली है. अगर at the end of the day you are so mentally stressed by choosing a branch which you never wanted yourself to be in, nobody is going to come and pat your back कि अच्छा okay it's fine, 3 साल निकालने हैं, निकल जाएंगे. नहीं निकलते हैं. People drop out in between the residencies because they're not able to handle the branches very much, right? So please sit and take a call wisely कि अगर if I'm made for non-clinical branch, I would go ahead with that and I would be happier enough. I would enjoy that branch for 3 years and definitely for lifelong as well, right? So very importantly, as I've told you earlier as well, that when you go for the medicine and surgical branches, doing your super speciality, doing your DM or MCH has become a little important when you start practicing in Tier 1 cities, because there definitely people are advancing and definitely you would want also to flourish there. So it's important there, but at the end of the day, if you haven't done your DM or MCH in these branches, then I feel it's okay. You can definitely establish yourself good if you're practicing as MD medicine or if you're practicing as MS surgery, right? At the end of the day, it depends all on your skill. It depends all on your talent of communicating with the patients, in making the patients, है ना. Patients आपसे कैसे attach होते हैं, आप उनसे किस तरीके से communicate करते हैं, किस तरीके से आप उनकी problems को सुनते हैं, address करते हैं, and then definitely you're going to advise them कि patient आपकी बात सुन के next time आपके पास आए, है ना. तो वो तो किसी भी चीज़ से नहीं हो सकता. मतलब a good college or a good branch or anything like that is not going to let your patient come to you. The only thing which is going to help you out in that is your communication skill and the way you handle with the patients, and that is what you're going to learn in these 3 years of residency, that how you have to make your patients, and making the patients, or making that good interaction with the patient is a skill, and believe me, it's a skill. Not everybody is able to crack that, not everybody is able to get into that, right? Now, very importantly, another very important question which I have got is that, ma'am, what is much better, medicine or pediatrics, right? See, both are branches which have almost a similar curve, and they have similar interaction with the patients, but the age group is different. If you are a kind of person who is happy to deal with the kids, if you're happy to deal with, and if you are comfortable enough, and if a patient is calm enough to handle the kids, please go ahead with pediatrics, right? And if not, but you want a branch similar to that, then go ahead with medicine, right? So that's the most important thing which I would want you to know. Then another very important question is that, ma'am, what is more important, or what is better, MD versus DNB? Okay, both of them are absolutely the similar, and my advice to you will be that if you're getting DNB medicine or DNB surgery or whatever branch you want to go for in a good Tier 1, Tier 2 city, in a good hospital where the exposure is good, where the academics is good, as compared to MD medicine or MS surgery or any other branch in a peripheral college where you feel the exposure is less or the academics is not good, please do opt for DNB. It's a myth, कुछ भी नहीं होता है. The only difference between both of them is कि DNB में you have your exams which are going to be taken by externals, जहाँ पर internal examiners का कोई रोल नहीं होता है. तो पासिंग रेट का डेफिनेटली इट इज़ एन इशू इन DNB, बट वो पहले होता था कि पासिंग रेट वॉज वेरी वेरी लेस. नाउ इफ यू लुक एट द डेटा, द पासिंग रेट हैज़ इम्प्रूव ड्रास्टिकली एंड पीपल आर डूइंग देयर फ्लरिशिंग इन DNB. एंड एट द एंड ऑफ द डे, अगर आपने MD मेडिसिन किया है, DNB मेडिसिन किया है, लेकिन उन दोनों कैंडिडेट्स ने बाद में सुपर स्पेशलिटी में, मतलब दे हैव डन देयर DMs, दे आर इक्वल. आई नो अ लॉट ऑफ माई प्रोफेसर्स हु हैव डन देयर DNB मेडिसिन और DNB surgeries, and they have done their MCH or their DMs from a very very good place, and both of them are flourishing. They are doing good, wonderfully good. तो डिफरेंस सिर्फ यहाँ आ जाता है कि DNB जो एग्ज़ाम है उसका थोड़ा सा क्लियर करना, पास आउट रेट आर लिटिल lesser as compared to MD medicine, right? But again, if you are working hard, if you are dedicated enough, if you have done your academics perfectly, you are going to get through the exam. This is not something which I feel is should be a question of you opting and going for a peripheral college just for going for MD or MS. Please don't do that with you, right? Then secondly, very important, the next most important thing will be that somebody who has got a very good rank, who will definitely be confused about opting for these 2 to 3 branches, or might be having a confusion between opting few branches, then for them my advice would be, if you are confused between opting for medicine or pediatrics, or medicine surgery or radiology, or medicine or radiology, my advice to you will be, please do visit the colleges which you are looking up to, that yes, these are the colleges which I feel I'll be getting. Okay, go in those colleges, look into the departments, go and talk with the residents there, go to the casualties, go to the OPDs, figure out that what is the exposure of patients look like, what is the work culture there, do you belong to this particular place, and then take a call. For example, when I was confused between medicine and radiology, I definitely went to my college and spent 2 to 3 days in radiology department and the similar in medicine department. Medicine I was very clear पहले से ही, मतलब internship वाले time से ही, लेकिन फिर भी still because I was confused during my decision, I went to radiology. I sat down in USG, in ECT, in MRI, and I looked that will I be just able to sit and not interact with patients and just deal with the films and just do the reporting, will I be happy enough? And my answer was no. After 3-4 days, my answer was no, that I am not made for this branch, and my call was taking medicine. Taking medicine as a branch was definitely the right one, right? So that is how I took this decision. So my advice to you would be, please visit the colleges, please talk to the residents, and please figure yourself out that are you going ahead with the right branch, right? And for the group of students who haven't got good rank, or who have got the mid ranks, right, and are still confused between taking a drop or compromising, or adjusting with whatever they're getting, your decision should definitely be based on your gut feeling and on your instinct. If you are ready to take a drop, please go ahead and take a drop, and if not, then please make good permutations and combinations and figure out a branch which you have to take. See, let's be practical enough and let's just accept the reality. The exam is getting difficult day by day, right? So if you are ready, and if you're courageous and brave enough and willing enough to deal with this one more year, and have the faith in yourself that yes, I'll be able to prepare for another 1 year, then sit and drop this year. And if not, please do opt for a branch which you are comfortable in and which you are getting at your rank this year as well, this year only, right? So please do not do this mistake of dropping a year just because you want to prove it to somebody, or you want to prove it to your parents, or you want to prove it to your relatives. No, don't do that. Don't do that blunder at all. Please take a wise call in this thing, right? Then the most important thing which I feel that has come up into my feeds is, now what is more important, a dream branch or a dream college? Please understand this thing. A dream branch is very opting for the dream branch, the right branch, is very important as compared to the college. I'll tell you why. I was getting almost all the branches at my rank in colleges in my native place in Delhi, right? I was getting it, all of them, and definitely who would not want to stay in Delhi? You have all the perks there, right? But I was not getting medicine there, right? And I knew that either I can stay here and live with my family, stay near to my family with whatever branch I'm getting, or I just choose to stay at a place far away and just living my life the way I've always visualized it, right? So after a lot of struggle, then I decided to take a call. Okay, fine, I'll go. I'm going to a different state, but I would be living as a medicine resident, the one which I have always dreamt of, the one which I've always visualized myself in. And trust me and believe me when I say that I'm so happy and so grateful of this decision of mine, that yes, this was the right thing which I did, because every single day I am always just sitting back and just when I look at my day, you would find a few of the incidences which make you so happy when either you deal with the patient, or you might have come to a provisional diagnosis, or you might have cracked something, or you might have cracked some patient, or you might have handled some emergencies in a very perfect manner, and where your seniors might have appreciated you. So these are certain things which make you feel that yes, your call was right. And at the end of the day, if you are satisfied enough, if you're happy enough with what you have chosen, is definitely going to be your guide, is definitely going to be your torchbearer of you being able to take the right decision. Like, I feel happy almost every day, right? So then most importantly, I would definitely want to tell you about the most important factors which you should take into consideration while you choose a college, right? Definitely, first of all, तो branch मिलनी चाहिए आपको उस college में, है ना? Secondly, the work environment and the safety around. Very importantly, less practical, safety बहुत important है ना? बहुत peripheral colleges में I feel थोड़ा सा issue रहता है safety का, but when you come into tier 1, tier 2 cities, it's comparatively better. Again, I will not say कि बहुत ज़्यादा safe, secure, बहुत high level security कहीं पे भी है, नहीं है, but it is much better as compared to that. Then very importantly, the work environment, the work culture, toxicity कैसी है, how are the seniors there, how are the consultants there, are they actually treating you like as your students or as your juniors? It's very important. What is the number of exposure, what is the exposure there, what are the number of patients in the OPD there, number of patients in casualties, number of patients in OTs. It's very important. Academics इन्हीं से निकल के आता है. जितने ज़्यादा patients होंगे उतना you will study, उतना you will discuss it with your seniors, उतना academics improve होता है, because you get to study and learn more. It's very important. Then very important is food and language. मुझे ऐसा लगता है थोड़ा सा important है यार. Food आपका अच्छा होना चाहिए. Your gut health is very important, right? And language का barrier नहीं होना चाहिए, because at the end of the day you will not be able to understand what your patients are trying to communicate or tell you if you have that language barrier. For example, I opted out for colleges in Maharashtra because वह rounds मराठी में होते हैं यार, तो कैसे समझ में आएगा कि मतलब क्या बोल रहे हैं? तो I would rather prefer to go to a place where Hindi or English is being used. So food and language is very important. And very important is that somebody who is highly homesick, तो should go ahead with a college जो पास में हो करके, and somebody who is able to handle homesickness, then definitely go ahead, let you fly, just open out your wings and just choose a college which you feel like, where you're getting your branch, where you're getting your college, where you're getting everything in the perfect manner. Go out, enjoy. Residencies will be fun for you if you take it as a journey of learning, of experiencing, or of living a branch which you always have thought for. So definitely it is going to be very wonderful journey ahead for you. And in the end, I would just say that there must be some students who would take a call based on कि ये ब्रांच ज़्यादा मनी देगी और इस ब्रांच से मुझे ज़्यादा पैसा मिल सकता है, ऐसा कुछ हो सकता है. तो according to my 1 year of residency, what I felt is money is going to come with your skill, है ना. आप कोई भी branch choose करो, whatever branch you choose, your patients are going to come to you because of your skill, because of the way you communicate, because of the way you deliver your because of the way you actually deal with them while you're interacting with them in your clinic, right? So money is going to definitely follow you if you are dedicated and if you're punctual enough towards your profession, towards your daily routine. That's the most important thing which I have felt. Nobody's going to come to you and will give you money if you're rude enough, if you do not know how to crack a diagnosis, if you do not know what should be the next step or the next investigation you should advise, right? If you advise a hell lot of investigation and which are definitely going to make the patient pay you more, then definitely that patient is not going to come to you the next time. So प्लीज़ नॉट टेक अ कॉल कि मैं रेडियोलॉजी इसलिए लेना चाहता हूँ, डर्मेटोलॉजी इसलिए लेना चाहती हूँ क्योंकि मुझे पैसा मिलेगा, या ये दीज आर ब्रांचेज विच आर गोइंग टू लेंड यू मनी. डेफिनेटली बिलीव मी, मेडिसिन, सर्जरी are going to give you good money, but again, if you are skillful and if you do have that dedication enough for the branch, right? So do not fall in the trap of money at all. We do get a good salary in a residency and post-residency also. When you're doing a SARship or you're practicing anywhere, right, you definitely are going to get a good amount to live a luxurious life also, right? So just take a wise call of opting the right branch. Do focus on the important factors which I have dealt and which I have discussed here. All of them are based on my personal experience, which I felt during my decision of going for the particular branch, right? So that's it. And if there is anything else which I should have talked about in the video, or which you would like me to talk about in the upcoming videos, DM me, right? Or drop a comment in the comment section. I would definitely go ahead and discuss it in the upcoming videos. Till then, take care of yourself. Just stay safe, happy, healthy, and take a wise decision, right? Enjoy this phase. It is not going to come back once the residency starts. बहुत दिक्कत होती है टाइम की, तो do enjoy this phase which you have got, and definitely do take the right decision and the right call for the branch ahead, because it is definitely going to decide your upcoming years, is going to decide your mental peace and mental health of the upcoming years. So taking the decision of the right branch, again the right branch as not the right college, is very important, right? So all the best, take care, bye, good night.